All right, we're back on this St. Paddy's Day. Final full segment with Commissioner Rhori Williams, who is so kind to join us to spend an hour to talk a little more and share all of the unique services with the Tennessee Department of Mental Health and Substance Abuse Services, from Memphis all the way to the Tri-Cities, and Nashville down to the Kentucky border to Alabama. Every county, there are options for people, always changing, always growing, trying to serve the needs of folks. So if someone has maybe a loved one or a family member that's struggling, Commissioner, and isn't sure what to do or needs some help, needs some guidance, how can your department help?
Here's how we can help. Number one, we have a great set of 24-hour, 7-day-a-week individuals that will take your calls if you want to talk to someone about substance use treatment and services. That is our statewide Tennessee Red Line. It is run by TADIS, and that phone number is 1-800-889-9789. So if you are wanting to speak to someone about what services would be available, that is the number to call. The next number is if there's a crisis that's a mental health crisis and you are wanting to get help for someone in a crisis or to talk to someone, that number is 855-274-7471. And then finally, if you're sort of not sure about what to say or what to do when you're talking to someone who tells you that they're struggling, I would just say, number one, compassion. The most important thing that you can do when someone comes to you with a concern or a worry is just to say to them, I'm listening to you.
That's so important, because, and I'm sure that just being able to, just getting someone to pick up the phone and call, I think maybe that, there's that block, the stigma we talked about. They don't know what to expect. They're worried about anonymity. And then once they call, they realize, the folks on the other end of the line are really true professionals and know what they're doing. So I'm sure it's remarkable to hear someone who says, I am so glad I made that call.
Right. And just that ability to say, I hear you. I may not have all the answers, but I do know who we can call and talk with, maybe get the answers. And Rhori, you're right. The people in this state that work for substance use providers and our mental health centers are top-notch. They are consummate professionals. And the majority truly got into this because they felt a calling.
It's a calling. I was just going to say.
So I think that's important to know. The other thing is that there are so many other individuals that can help. Our faith-based institutions. We've been doing the recovery congregations across the state, certifying congregations in areas of mental health and substance addiction, so that they would know how to intervene. So calling a pastor of someone and saying, can we come in and talk about what's going on? Offering to go with your friend or your family member to a walk-in center is very, very helpful.
Right.
But mainly the most important thing is to say, it's okay if you're not feeling okay, and we'll get through this.
Well, and I'm glad you mentioned faith-based, because not only are we talking about your department and the actual employees of the state of Tennessee who work for your department, but you have a lot of networking and outreach. You've got to work with faith-based groups, nonprofits, with certain services that you're contracting out to privately run organizations. So it's a lot of different people, and you've got to kind of be symbiotic and working together. But really, the churches, synagogues, faith-based groups, and nonprofits here in Nashville and all across the state, they're phenomenal and can be that first, kind of front line for you.
Absolutely. And places like NAMI of Tennessee, the National Alliance for Mentally Ill, that's solely for family members. and individuals to get support when they're working with someone that may be struggling with mental illness. Then you've got the Tennessee Mental Health Consumers Association. And that's for individuals who are actually getting support themselves to help one another. We've got a great group of individuals that are working with that. Mental Health America that I was speaking about earlier. Jeff and Tom are just amazing people. Tom Starling is the CEO there to help. The Jason Foundation with Clark Flatt if you're struggling with suicide. That program, the Tennessee Suicide Prevention Network, as well as our regional overdose prevention specialists. Wow. There's so much. I mean, I would say to people that if you look at the bottom line, we know that there is hope. We know that there is healing, and we know that people recover. If you want to see some real life stories of that, go to our website. Our incredible Matthew Perriott has done a great job.
I gotta stop you right there. I'm sorry, we're up against a hard break. Thank you for being with us. And when we come back, I'm going to share some contact info. But Commissioner, thank you so much. We appreciate it.
Appreciate it. Take care.
Bye.
All right. Bye-bye.
Be right back.